My name is Dr. Helen Flanagan. I'm one of the psychologists with PPAS. I'll be talking about what you can expect during a diagnostic assessment with our team. The IWK Health Center, where this video is being recorded, is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people for over 13,000 years. In this video, I'll talk about who's involved in the diagnostic process and what to expect. We accept referrals for toddlers, preschoolers, school-age children, and teenagers. Families might be seen by a single clinician, such as a psychologist or a developmental pediatrician, or they might be seen by two clinicians working together. There are two components to every assessment. A clinician will carry out a detailed interview with parents or primary caregivers. These are some of the things that we will ask about. Early developmental milestones, for example, how did the child communicate at different ages? Health concerns, for example, are there any concerns with eating or sleep? We will ask about how the child interacts with other people, how they play or how they used to play when they were younger, and how they're coping. The interview might happen in person or it might happen over the phone or using Zoom for healthcare. A clinician will also interact with the child and observe their behavior. Activities depend on the child's age and language level. For younger children, most activities involve playing with toys like bubbles, small figures, or blocks, and caregivers usually stay in the room throughout the assessment. For older children and teenagers, activities might involve answering questions, doing a puzzle, or telling stories. The child or teen is usually seen by themselves for at least part of the appointment. Some assessments involve other components. These might include a medical checkup, activities to explore thinking and reasoning skills, or parent and teacher questionnaires. The goal of the assessment is to identify a child's strengths and difficulties, and to see if these meet the criteria for a diagnosis of autism spectrum disorder or not. We'll also discuss next steps and recommend helpful supports. Clinicians will explain what they've learned about the child and give time to ask questions. They'll also write a report. We keep health information private or confidential. We put a copy of the report on the child's health record, and we usually send it to any doctors involved in the child's care. Families can choose if they'd like to share the results with the school or with any other community supports.